like Chris before me, I've known Randy for quite some time. I've had a long-standing relationship with his previous company, Tech. At the Glenrose, we are undertaking a program to introduce and trial innovative technology for rehabilitation of Albertans of all ages who must live with musculoskeletal, neurological, or psychosocial problems. Through the dedicated work of our foundation and the generous support of donors, we recently opened the Building Trades of Alberta Courage Centre. And the centre is a focal point for the application of technology related to robotics, virtual reality, cognitive learning, and telerehabilitation to improve the outcome of all Albertans. But it stands on three legs. The first and foremost is clinical service. The second one is research and education. And the third one, importantly, is industry collaboration. Of the three legs, clinical service is perhaps the only one that we might possibly do on our own, although we have many, many important partners in that particular area as well. On the research front, we have been able to work with many leading educational institutions in Edmonton and Alberta and around the world. But as a public health organization, Glenrose did not produce any products for commercialization. But we realize that the staff of the hospital are among the most knowledgeable staff anywhere in terms of the needs of people with disabilities. And to achieve the best outcomes for these people, we need to work with partners in the private sector. And that basically drives a lot of the work that we're doing with connector agencies like TR Labs, like Cleankeys. Today is a good example of how doing so can work well for everyone. The themes we established, robotics, telerehab, cognitive learning, all rely on computers, and associated with every computer almost is a keyboard. The Building Trades of Alberta Courage Centre is located adjacent to a very busy inpatient area. We put it there to optimize its clinical effectiveness, its clinical exposure, but as a high traffic area, it presents a lot of serious obstacles to infection control. And we have had more than one discussion with our infection control nurses about this. The traditional keyboards that we've been trying, even those that can be washed, have difficult infection control issues, so they aren't the solution. So we were very pleased when we learned that Cleankeys was available, a local product, and have recently ordered 10 to facilitate our infection control issues. We've also looked forward to working with Randy and Cleankeys to evaluate them and see how well they work in terms of limiting the spread of infectious agents. I'm particularly pleased to support a local Albertan company to extend our relationship with Randy and his crew and to be able to contribute in a small way to the formation of a health product sector in Alberta. That, too, I believe, is in the best interest of our patients and our staff. In closing, I would like to acknowledge the generous support that we received from the Minister's Department of Advanced Education Technology and from the NRC Council towards our efforts to work